Well, good evening, folks. Thank you for joining us tonight for GCA's webinar series. This is our third month to do this. This specific webinar is focused on from the field. These are people that are out in the field daily that are working with you and among you to help improve our industry daily. We've got representatives from the Georgia Department of Agriculture, the University of Georgia College of Veterinary Medicine, as well as the Georgia Veterinary Medical Association. With that said, this webinar is also being sponsored as part of our Cattlemen's Education Series. This is the final one of those. And so you will be receiving a survey at the end of it to review how we did here. This is, of course, in support of our grant program that we have through NCBA's Continuing Education Series. And so tonight we are very fortunate to have several different members from across the state here with us. We obviously have Dr. Brad Hines with University of Georgia, Dr. Brent Crediel from UGA as well, Dr. Jill Lancaster with the Georgia Veterinary Medical Association, and then Dr. Jane Marie Hennebel with Georgia Department of Ag, as well as Mr. Jason Wamba. So tonight we're going to be going through we're going to cover a lot of topics, a lot of variation in these items, but these are the emerging issues that they see out and about as they work within our industry. So we're very thankful to have them with us tonight, and we hope that you share that sentiment with them as well. We also have Miss Marty Brick on the line with us from University of Georgia College of Vet Med as well. So real quick tonight, I want to start off. We're going to start with Dr. Brad Hines, who's going to be bringing us a presentation, specifically focusing on that. But real quick first, let's talk about Georgia Cattlemen's Association. There are five main things we typically do. We are a membership-led organization. We focus our efforts primarily on community engagement, which is fellowship amongst each other. And right now, that's a little different to do. This is a new normal for us on the webinars versus meeting in person, but I'm glad that you were able to join us through that. We also handle producer education. This is a great example of that. This is a way for you to continue and further your knowledge within the industry. And then we also help to support market development within the industry. Again, trying to grow the pie so that each member of the industry is able to be profitable and continue to raise the quality beef for consumers as well as their own families. And then lastly, our legislative representation. This is both in Atlanta and DC. GCA has been very active for many, many years in that regard, and we continue to handle that day in and day out. So just wanted to thank you for joining us tonight. So at this time, I'd like to open it up for Dr. Brad Hines, who heads up the Beef Herd Health Program, and we'll allow him to be presenting with us at this time. Dr. Hines.
Thank you, Dale. And it's more of a team effort up here than me heading it up. Dr. Crediel, myself, Dr. Lee Jones down in Tifton. We kind of work together throughout the whole state, trying to provide as quality service as we can to not just other veterinarians, but producers, and support as we move around and see what the industry needs throughout the state. So thank you for having us today. Go ahead, Charles. So ultimately, any herd health program, we can't just use the canned program off the internet. It really has to balance what the animals on each farm need, as well as what the farm will support economically. So it varies. I don't just have one thing I use for each farm. And just because we can do something doesn't mean we always should. There are economic constraints, there's physical constraints. You know, labor is a huge issue that we have as we're moving through some of these production units, and finding people who can be there to provide things at the time they need to be done is sometimes difficult. You know, we've older family members sometimes rely on younger members to come home on holidays and help process cattle and get them loaded up to go to the market. So these things are all constraints that we have to consider when we develop a herd health program. Go ahead. Really, it all comes down to nutrition. It doesn't matter what vaccines we give the cattle, what anthelmintics or dewormers that we use, what antibiotics that we choose. If we're not feeding the cattle correctly, we really can't overcome that loss of nutrition in improving reproductive success, looking at the health of the animal, getting those cows to calve appropriately without needing additional assistance. We need access to clean water, and we need to provide an adequate mineral source for these cattle. We're deficient in different parts of the state for different minerals, and so it's important to evaluate what's present, what our cows actually need based on what their production status is as well. So using a high magnesium mineral at certain times of the year can be appropriate. Other times it may not be necessary, but I usually won't touch it if the cows are eating it well. We're going to leave high magnesium mineral present in that herd as long as they're eating it fine and moving from there. Weather has a huge impact on nutrition. It can affect feed intake. It affects the nutrients these cattle actually need. Their maintenance energy requirements increase on both sides of the thermoneutral zone. So right now, when we've got heat stress, we need extra maintenance energy in order to accommodate that heat stress, just as much as we do when it's 25 degrees outside in the middle of December. And so we really have to balance our nutrition program with the forage that we have available for these animals, as well as what the environmental stress is and the production status of those cows. Their protein demands vary throughout the year. So we've got different grass varieties throughout the state, soil types, environmental conditions. Up in the mountains, it can be 30 degrees cooler than it can on the coastal plain. And so we also have fescue there versus a Bermuda grass type grass in the southern part of the state. All of these conditions will affect the protein and energy available in that grazed forage. It varies throughout the year, and as the cattle are grazing on it or as we're harvesting it for hay. So we always need to be cognizant of what's happening in terms of the cow's diet and supplementing appropriately so that we're able to maximize their production. Number one step I make with a herd health program is always to get a complete forage analysis. If we're buying hay, it's incredibly important. You never know what you're purchasing. You don't know what nutrients were applied to that hay. So if we can work with our local extension agent or just submit it on our own, if we can get that analysis, we can align supplemental feedstuffs based on those nutrient demands. We can identify possible toxicities in that hay. And we can supplement appropriately based upon that cow's production status. So those cows that are coming into peak lactation, 45 to 75 days post-calving, we can really supplement those cows in order to maximize their lactation and get a calf that's going to develop well, not have health issues as we're moving forward. In cold, wet weather, energy is probably the most common limiting nutrient, not protein. So we always need to consider that as well. Are we getting enough energy in these cows? Do we have enough fat in the diet to overcome days that are cold, wet, and miserable for those cows and for us? Once we move beyond nutrition, the next thing I like to talk to producers about is where are we buying our cattle from? Where are we getting our replacements? Biosecurity has been a big topic on swine and poultry for a long time, but it's just as important in our cow herds. It's the process of excluding disease through physical barriers. And that can be as simple as fencing, making sure that we've got appropriate fencing between our herd and the neighbor's herd. It can be washing the trailer when we come home from taking cattle to the market. Sale barns are honestly some of the worst places to buy replacements. They can be cheap, but we never know why an animal's at the sale barn. And so we run the risk of bringing things back to a farm anytime we purchase animals. But sale barns put us at a little bit higher risk because sometimes those animals are there because they may be sick, they may have lost calves in the past, there may be reproductive issues that don't show up superficially on the animal. So something like Tritrichomonas fetus, that can be present in the cow. We never can tell what's happening until we get the animal back and all of a sudden we have a train wreck in our breeding program for the next year. No matter where we buy animals from, we should always quarantine them. That varies based on the individual herd, what diagnostic testing that may have been done ahead of time. But I like to leave animals isolated for about 30 days if we can do it. It gives us a chance to really evaluate that animal, look at their behavior, look at how well they do on the forages that are available to them, particularly if we're moving them through different parts of the state, getting them on different grasses. And so I like to have those animals up for about 30 days. After that, we can put them out with the other cows. We've generally gone beyond the period where we're going to have a disease outbreak, if we can wait that long. Diagnostic testing, we could throw the book at new cows, but there are a few minimum things I like to do, looking at BVD, anaplasmosis, Those diseases are some that we can test for easily and cheaply and can make a really big difference if we can identify it before we introduce them into our cow herd. Biosecurity also includes how we manage cattle within our own herd. And so changing needles between cows reduces the risk of spreading bloodborne parasites between animals. We can utilize products to reduce the fly burdens on cows. Those flies can do the same thing as a needle can. They can transmit diseases back and forth. Ticks do the same. We need to clean and disinfect our facilities following use. So if you've ever had show cattle and they come home with ringworm from a show, this is one of those things that cleaning that facility and trying to get organic matter down, letting it dry, exposing it to sunlight, all of these things can play a role in reducing the exposure of our cattle to diseases that could really affect the bottom line of the herd. Cleaning trailers following cattle transport. Let's hose them out. Let's use a mild disinfectant if we can, and let's let them dry before we put cattle back onto that trailer. And then again, any show equipment, halters, lead ropes, brushes, any of that really should be cleaned when we come home from a show. When we look at the diseases that we deal with, I kind of like to lump them into categories. And so reproductive diseases are typically number one. Some of the most common things for veterinarians to be called out for are lower preg rates in the herd, abortions in the cows, calves that come out looking deformed or maybe diseased early on after life. BVD, IBR are two viral diseases that can affect both the cow and the calf. And then we have leptospirosis, vibriosis, and trichomoniasis, which are bacterial diseases. Now, all of these can show up during gestation. BVD can affect the calf later on. What we may see with these can vary depending on when the animal actually got infected. And so trichomoniasis, we may see cows that are calving later than what we anticipate. She was always on time calving. Well, now we're 65, 70 days late on this group of cows. Vibrio can do the same thing. Lepto, we'll see more open cows at the time of pregnancy exam. Another category we like to look at is respiratory disease. Some of the same viral pathogens, so BVD and IBR, can create immunosuppression in these cattle. They can open the door for some of our bacterial diseases or even other viral diseases. PI3, parainfluenza virus, and BRSV, bovine respiratory syncytial virus, can both come in as well and create primary viral disease as well in these cattle. We can see pneumonia, we can see high fevers, we can see sudden death in these animals. The bacterial pathogens, I tend to think of more as secondary. We can have them come in early on. If we're bringing in new cattle, we bring in a group of young calves and mix them together, we can see primary bacterial disease, particularly with Mannheimia and Pasteurella. Those can really set up these calves to look pretty poor after just a day or so of infection. They'll have high fevers, coughing, nasal discharge are all common symptoms that we see associated with these bacterial diseases. Gastrointestinal disease. So calves, it's not uncommon early in life to see rotavirus, coronavirus, E. coli, salmonella, coccidia, and a little bit later, some intestinal parasitism. These have been around a long time. We've got great products to treat, particularly parasitism, but we still see animal losses associated with it. Early on, the first week to 14 days of life, if we've got high concentrations of cattle during the calving season, we'll see a lot of rotavirus and E. coli. It's not uncommon at all to have outbreaks, to have death loss, high morbidity, a lot of illness that moves through our calf herd early on in the calving season. With cows, we've typically moved beyond a lot of these other diseases. So coronavirus can still play a role in cows. We can also see salmonella, but most commonly we probably deal with Johne's disease. It's a kind of a chronic diarrhea. It's an infection that occurred earlier in the life, but it causes a malabsorptive diarrhea where these cows just are not able to gain energy and protein from their diet. They're actually spilling most of it out back into the environment. With intestinal parasitism, I've still seen mature cows that die in the wintertime due to intestinal parasitism. As many products as we have available, as many routes of administering it, we still run into issues every year with cows that are suffering from some of these diseases. Clostridial diseases. So blackleg, malignant edema, and tetanus. We've got vaccines available for these. They're roughly $1 a dose. These vaccines are highly effective. We can prevent most of these diseases through vaccination and timing, castration, and dehorning associated with that vaccine. So we want to make sure if we're not castrating at birth, we're going to use a tetanus product at the time we're going to castrate those calves or ban those calves. Again, it's cheap. The loss of one calf will pay for years of this vaccination. So it ultimately is used to reduce the risk of disease outbreaks. We are not going to eliminate all diseases in our cow herds through vaccination. Every dose we give is not effective in those cows, and so that's why we recommend yearly boosters. That's why we do a single shot and then follow it up with a booster 3 weeks later when we're first acclimating cows to these vaccine programs. We need to make sure that the label directions are followed. We're going to booster those vaccines that require it, and we're going to vaccinate according to the production stages. So we don't want to use a modified live in cows that may not have ever seen it before, particularly if they're pregnant. Now, if they're open cows, it's fine to use a modified live, but I don't want to come into cows that we've recently purchased, maybe pregnant, and just wantonly use a modified live viral vaccine. We run the risk of creating some problems when we go through and do that. Even with our killed products, we run the risk of having issues with air, particularly with heat stress. Some of our killed vaccines can create their own problems with heat stress, with endotoxin load in those vaccines. And so we can create some problems as we come through and use some of these products inappropriately or in ways that they're not designed to be used. So modified live vaccines, they may be attenuated, which means that the organism has been changed slightly so that it does not cause clinical disease in the animal. They're usually capable, the organisms are capable of replicating within it, and they'll stimulate a form of immunity that's very similar to a natural infection route. That varies from our killed vaccines. They're commonly inactivated by chemical methods. And so those adjuvants are present in there. They stimulate the immune system. It attracts our white blood cells to where we inject that vaccine. They take that organism, the killed organism, or the portions of that back to the lymph nodes, and they create an immune response to those portions due to the adjuvants. They generally create a slightly weaker immune system. That's not always true. Immune system response to the modified live vaccines. But many of them are excellent vaccines. They work extremely well, and they've got a place in just about every cow herd to use killed vaccines. Toxoids actually contain some of the toxins that these organisms produce. And so some of our Mannheimia vaccines for respiratory disease, so our tetanus toxoid vaccines, they contain these toxins to stimulate the immune response to that toxin and reduce the impact of that. So which program do I recommend? I honestly don't care. I'll use Behringer's, Zoetis, Elanco, Merck, whoever's out there. There's really no major difference when comparing products as long as we do it correctly and consistently. I really recommend you work with a local veterinarian. They'll understand the risk within your region much better than somebody who may be located in the Midwest and recommending a program. Base it on the history of your herd. Look at what's happening there. Look at what you've used in the past. Are you having a problem? If you're not, why change? You know, cost-wise, there's not a whole lot of difference between these. Don't go with the program of the month. Pick a plan and stick with the plan and use it consistently as we move forward. One concern, I mentioned this a little bit earlier, is endotoxin loading. And so many vaccines contain fairly high levels of endotoxin. Leukotoxin is one of those. Our scours and our pink eye vaccines contain that as well. We really should avoid stacking many of these vaccines at one time during hot weather. And so if we're going to go through and vaccinate cows this time of year, I'm going to start 5 or 6 in the morning. I'm going to be done working cows by about 8 o'clock. We're going to try to avoid more than 1 or 2 endotoxin vaccines at the same time. I've seen vaccine programs that have had 4 or 5, and we always run into problems at some point. May not be this year, but sometime in the future, we're going to see problems with endotoxin if we continue to use that many high endotoxin vaccines. With dewormers or anthelmintics, we're seeing increasing information throughout the state and really throughout the Southeast regarding parasite resistance. It relates to incorrect dosing of cattle. So cattle don't weigh what what we think they weigh. So buying a set of scales is really important. Get an accurate weight on that animal, dose it appropriately. Administering anthelmintics too frequently can create resistance problems. We also, as an industry, we've gotten towards where we're using it as topical fly treatment. So some of the cheap generic products that are out there, it's been much cheaper than going out and buying a product that's specifically labeled for flies. And so that product has created resistance across the whole spectrum of our anthelmintics that we have available to use. So we really need to back away from using those as just fly treatment. Let's use them appropriately. Let's use them strategically as we're going through the year. So we don't want to use them and then run the risk of cattle being reinfected right away. We want to work with the environment. So in the summertime, when we've got a lot of heat and drying out of the pastures, if we can come through, deworm these cattle late spring, first part of summer, let our summer heat stress dry out the pasture and kill a lot of those parasites that are present, we're really going to reduce the environmental burden that's there without having to touch them with a dewormer and multi-treatments there. We can sometimes do the same thing in the winter. If we get cold enough, we can reduce the effective pasture burden if we're below 30 degrees for a long period of time. Now, it's been a little hard to find in certain parts of the state, but you know, it is a strategic plan that we can use. Calves are most commonly affected by Couperia intestinal parasite. It's highly susceptible to our benzimidazole dewormers, so our white wormers, Safeguard and Panicure, Synanthic and Valbazen. They're all highly effective against the Couperia species. Treatment should always be according to weight or treat to the heaviest weight of the group. So we don't want to underdose a 6-weight calf when the rest of the group is 400 pounds. We want to make sure that we're treating everybody according to what their actual weight is or rounding up as much as we can. Cows are affected by an Ostertagia type of worm, primarily. These are really where we're seeing a lot of this resistance pattern develop. There are different classes of anthelmintics that are having emerging resistance. So our avermectins, ivermectin, aprenomectin, and doramectin, and our macrocyclic lactone, which is moxidectin. So these are our major pour-on products that we have available and injectables. When we measure by fecal egg count reduction test, which is one of our diagnostic tests where if we treat with a dewormer, we can come back in and we can look at how much of a reduction of egg shedding we have over time. When we look at that egg count reduction test, we're seeing very variable reductions. And so it may be as high as 100% in some herds or in some groups of animals, and in the 30s and 40% in other groups. And so we really need to be careful. Let's use diagnostics appropriately to determine where we may have resistance, and let's adjust our treatment plan, such as adding avermectin class dewormers with benzimidazole, the white wormer products. We should get our efficacy above 90% on those herds. So again, strategic deworming. Avoiding that resistance can require combination therapy, and we want to treat when the risk of reinfection is lowest. And so fall treatment as worm transmission decreases in winter, and late spring treatment as the summer heat impacts their survivability on pasture as well. With purchasing mature cows, let's avoid the sale barn if possible again. We have reduced risk of disease, lameness, we can have poor reproductive potential, and poor performing animals. Those are all reasons that cattle wind up at sale barn, mature cows. We want to avoid purchasing open cows without calves on their side. Those cows may have missed breeding cycles. They may be at a higher risk of pregnancy loss. They may have reproductive diseases that can come in and really devastate a defined breeding program in a herd. So these are all reasons to avoid going to the sale barn. You know, if you do that, there are plenty of options out there to look at diagnostic plans. So prior to the introduction of a new animal, I recommend testing for BVD, anaplasma. If we're buying bulls, I always recommend a trick test in non-virgin bulls. With vaccination, we want to match the established herd health program as much as possible, keeping in mind the pregnancy status of that animal. So depending on where we're buying her from, we may not know what her previous vaccination plan was. So let's start with something safe. Let's start with something simple, and let's match it up to the cow herd, trying to get them on a plan to where we can move them into the regular vaccine program going forward. The other thing, and really one of the last things I like to do as I'm working cattle through a chute, I want to look at their age. If a cow's thin, I want to be able to look at her teeth. I want to know what she may have present. Is that a reason for her to be thin or losing weight or maybe not pregnant? With young cows, particularly purchased cattle, I want to make sure that what I bought, what I paid for is what I got. So we're going to go through these slides pretty quick. This cow has her first 2 permanent incisors in. This is going to be about a 2.5-year-old. The rest of them are all immature teeth. The same on this one as well. You can see those first 2 teeth have erupted here. Again, 2.5 years old. The rest are all immature teeth or deciduous teeth. She's going to lose those over the next couple of years and replace those with permanent teeth going forward. This is a mature cow, 6-7 years old. All of her permanent teeth are present. They're all in good shape. They're all in even wear. We don't have any missing teeth. We don't have broken teeth. The gum line is still way up high to where that tooth looks more like a shovel, and we don't have exposed tooth root. So this is a good mature cow. Find no reasons to be concerned about her age or her dental health at this point. This cow's a little bit older, probably 9 or 10 years old, looking at her teeth. A lot of wear. You can kind of see some uneven wear on those teeth. They've separated out. The teeth are not touching themselves or touching each other quite as closely. Another 6 or 7-year-old cow here. So again, you can see how close the teeth are to one another. Good fill there. This cow is going to maintain her body condition out on pasture with no real issues. We're getting into a few older cows here. You can see where the gum line has started to recede and we're getting tooth root exposure. We've got a few missing teeth. We've got some separation between the teeth. And really that kind of shovel of the end of that tooth is really starting to get worn down quite a bit. So this cow, I'd probably put it at 10 to 12 years old, if not a little bit older. Another cow with quite a few missing teeth. Those there on the left side of her mouth would be the right side of the screen. You can see how worn off and broken those teeth are. If I'm going through and looking at cows, this is a cow I'm going to recommend to sell, regardless of her production status, regardless of where she is. If we can get the calf that's on or off of her, let's go ahead and do that. Let's get this cow moved before we continue to lose weight on her going forward. Another broken mouth cow here, so missing a couple teeth on her left side, on the right side of the screen. The gums are worn down quite a bit, and so this is another cow that runs the potential of continuing to lose weight as we go through a grazing season. They're just not as efficient out there cutting grass with those teeth. So if you've got any questions, feel free to email. I'm happy to answer those at any time. And if you've got some today, I don't remember if Dale mentioned it, we can use the chat feature to try to send some questions in as well.
Absolutely. Thank you for that reminder, Dr. Hines. Anyone, if you have any questions, feel free to enter those into the chat box. You'll find that down below in the Q&A portion. You can click on that button and enter your question. We do have a couple that have been submitted already through this. So I'll just read these off to you, Dr. Hines, if you'll take a good stab at them. Recently, I've read some accounts of producers claiming that going to only a killed vaccine on breeding age heifers throughout their life increased their pregnancy rates, AI, and embryo transfer rates significantly. Is there any research to back that up, or have you seen anything like that?
There is some research that has shown some benefit to killed viral vaccination over modified live. Now, that's not been widespread proven. It's not definitive throughout the entire industry. It's been limited to the few herds that have really been thoroughly examined. These studies are really hard to do. And so it's very hard to come through and say that, you know, this vaccination is the reason for losing production in these cows. And so it's really hard to do that. With that being said, as I mentioned before, defining a vaccination program, being consistent and intentional about it is probably more important than what product we're using overall. So if we're going to use a killed program, let's use it continuously. Let's stick with the same product that we're using. Let's give it the same time every year. So if we're giving a killed vaccine at the time of pregnancy exam, let's make sure we do that every year. But it's the same thing for modified live. And so I really like to use a modified live in an open cow in a pre-breeding vaccination manner. But it's just my personal preference. I don't have an issue with using it in pregnant cows that are appropriately vaccinated as developed heifers. So it's really personal preference, but we need to try to stick with the label as much as possible, not go off label, and let's try to match our program with what we're actually seeing in the cows and do it consistently.
Thank you. Had one submitted through the chat box here. Is it recommended to give annual tetanus shots?
It really varies on the individual herd. I've had clients that have never used a tetanus shot and never had a problem. I've had clients that give tetanus shots every year and have tetanus every year. And so if you feel comfortable giving a tetanus vaccination, whether it's combined with a 7-way clostridial or even separate from it, it's not going to hurt the cow to give a tetanus vaccination. It can certainly cause a lot of preventative disease. And so if I've got a chance to come in and change a vaccination program and make small tweaks to potentially improve herd health, tetanus is an easy thing to do. I do recommend giving clostridial vaccines to our mature cows every year. I don't like to skip our clostridial vaccines, and that can include tetanus to our mature cows. I do like to give it. We get colostral immunity transferred to that calf, and so we can have protection for that calf for the first few months until we're able to actually get a vaccine into that calf. And so it is not something I recommend skipping because she got it last year or 2 years ago. So I do recommend boostering that every year.
Thank you so much for that informative presentation. I know I learned a lot through it. Dr. Cardile, Dr. Brent Cardile, at this time, we'll call on you. Your topic tonight is utilization of the animal health and husbandry to enhance the cow herd profitability. Obviously, with the markets the way that they have been over the past few months, this is a topic that's near and dear to a lot of people's minds right now. So take it away if you don't mind, sir.
Thank you, Dale, and thank you, Dr. Hines, for setting me up with this. And what I wanted to do tonight was really spend a little bit of time looking at herd health in a slightly different way, more than protection from disease, which is certainly important, but how can we use herd health to enhance the bottom line of a cow herd? I think when I work with vet students, and certainly some of my clients, they look at me a lot of liability of the operation and adding cost. And I want to highlight the benefits that a solid herd health program can have for a cow herd from the standpoint of making your wallet just a little bit thicker at the end of the day. So when we look at the economics of cow-calf production, and I think everybody here tonight probably understands this, that cattle production is inherently a low-margin business. Low margin and high cost at that. If you look at studies from herds in the southwestern U.S., herds in the Great Plains, return on assets tend to be somewhere between 0.3 and 3%, which is relatively low. When you compare that to other businesses in the economy being around 10%, we're certainly in an industry that has some economic challenges in front of us and really are behind the curve on a lot of things when we compare ourselves to other industries that we work with. The interesting thing about it is, despite the fact that we are inherently a low margin, high cost business, the majority of producers across the course of any given year can make a positive return on the operation. And what you're going to notice with across most years, the average producer, which is here in your green bars, makes a profit. It might be a small profit, but they make a profit. You'll see here in 2014 and 2015, when the market were so astronomically high that almost everyone turned a profit, even if you're a low return producer. But again, take high return producers out of the equation, the opportunity is there in the average year for most people to make some money on the cows they have in the herd. This is an economic analysis that came out of Kansas State University just a few years ago. And what they did is they compared herds by profit category: high, medium, and then low. And what they did was they looked at first the profit side of the equation. And on the profit side of the equation, what they found is that for the most part, and there are some exceptions, high profit herds didn't really wean that many more cows, maybe 2% more across the course of a given year. They didn't get any more money for the calves that they sold, but what they found was that the calves that they sold were significantly heavier. In this case, nearly 70 pounds per cow heavier during the course of the analysis they used. And at the end of the day, what they found was that the high profit herds, gross income was about $130 per head more than the low profit herds, again, driven primarily by the weaning weights of the calves that they sold. When they looked at the cost side of the equation, what they found was that one, your low profit herds spent more money on feed across the course of a given year, nearly $120 more per cow in feed every year. The other things that they found were one, low profit herds tended to have more interest costs, about $8 more per cow every year, along with greater depreciation costs, and also greater labor and machinery costs that went along with that as well. And at the end of the day, what you find is that the low profit producers tended to spend about $200 more per year in total costs than the high profit producers did, again, driven primarily by the increase in feed costs. So again, to some extent, it is driven by profit, but in large part, it's driven again by the cost that you see on those operations. So the difference again is that these high profit herds tend to optimize production. They don't necessarily maximize it. They have an efficient system, but most importantly, they have relatively effective cost containment. And what they're doing is they're adopting management practices that improve profitability by optimizing efficiency, ultimately keeping costs down. So, as I said before, cow-calf production is a high-cost, low-margin business. And when we look at this, there are two ways for us to look at enhancing profits. One, we can cut costs, which is hard to do. There are ways to do it, but it's hard to do. The thing that I'm going to focus on tonight, rather than cutting cost, is looking at how can we utilize animal health technologies to increase income. What we're going to look at first is utilizing those different production enhancing technologies for long-term herd success. So when we look at best management practices, the first thing that we're going to look at, major focus, is optimizing the pounds of calf wean per cow per year. And there's two ways to do that. One is we increase wean weight, and two is we increase the number of calves that we sell. If we can increase how much they weigh and the number that we're selling, we can optimize the pounds of calf we wean within that herd. Regardless of the herd that we look at, you're going to see different levels of productivity across different operations. You have different priorities for those different herds. But again, our focus, regardless of how we're looking at this, is how do we enhance productivity of the cow and the land that we're using for our production system. So when we look at these best management practices, as I said, our goal is to optimize the pounds of calf we wean per cow. Two ways to do that. One is we increase the number of calves that we wean. The other is to increase the average weaning weight. One thing that you're going to notice from this chart that's here is there's a lot of different ways that we can do that. We can increase how old those calves are when they're weaned. We can increase average daily gain by using growth stimulants, enhanced genetics, increasing milk production from the cow. We can also try to get more cows and calves pregnant. Tons of different things go into this equation, and we're going to take a few of these tonight and highlight those. So when we look at the enhanced percent calf crop, what we're looking at, the number of calves that are weaned divided by the number of calves in the breeding herd that were exposed during the course of a specific breeding season. What you'll see in most herds is going to be somewhere between 70 and 95%. Some of the herds we work with, it can be higher than that. Other herds that we work with on the consulting basis, it can be lower than that. But on average, again, somewhere between 70 and 95% the calves that are born are weaned. Things that affect that, disease, weather, environmental conditions, and management. Others certainly play into that, but these are probably the four most common. When you look at the impact of enhancing percent calf crop, What we know is that for every 1% change in percent calf crop, every other calf in the herd is going to weigh 5 additional pounds at weaning. And so what you see is, as you go from a 90% calf crop to a 95% calf crop, the pounds of calf weaned per exposed cow jumps from 450 pounds to 475. Your break-even price drops from 123 to 111. So it's a pretty powerful thing there, just getting an extra few percent calf crop, what that does not only to the pounds of calf that you're weaning, but also what it's doing to the break-even price in the herd by lowering it and making it easier to make a dollar. Things that affect percent calf crop, the biggest one is we don't get cows pregnant. About 66% of the total reduction in calf crop that we see goes back to having open cows in the herd. We don't get those heifers, we don't get those cows pregnant in a timely manner, or we don't get them pregnant at all. Another 20% goes back to calves that are lost at the time of birth, principally due to the effects of dystocia. Others would be nursing calf death blocks. We go back to what Dr. Hines talked about with calf diarrhea, nursing calf pneumonia. That plays a role as well, but again, the biggest one is just not getting cows pregnant. So focus areas for me are what can we do to set this cow up for success across the course of her lifetime. So big focus areas for me, one is going to be heifer development. I'm looking at the age and weight of my heifers when they reach puberty. What I want to do is breed my heifers between 13 and 15 months of age. And I want to do that when they reach somewhere between 60 and 65% of their mature body weight. So if I'm developing heifers, if I'm purchasing heifers to come into my herd, they're this age, this is something that I'm looking for because that weight is going to be helpful in stimulating cyclicity, getting them ready to go. Other things that I want to do is I ideally want to breed my heifers somewhere between 4 and 6 weeks before I begin breeding my mature cow herd. One thing that's going to do for me is it's going to give me an opportunity to watch those heifers a little bit more closely during the course of a calving season. But what it also does, probably more importantly, is it gives those heifers time to cycle back around before that next breeding season starts. It gives them a little bit of a crutch that the cows don't need to help them stay efficient and give them a higher likelihood of having another calf in the next year. Other things that I want to do, and again, this goes back to some of what Dr. Hines talked about, is trying to control the postpartum interval. In other words, how long is it between when they have the first cycle during the course of the next breeding season? The easiest thing to do to control that is manage nutrition. And what I like to see in my mature cow herd is I want those cows to calve in at a body condition score of no less than a 5, but more ideally a 6. And something that's incredibly important and something we don't do nearly enough of is looking at bull selection and having a breeding soundness exam. When it comes to bull selection and BSE, one thing to think about is making sure we have enough bulls with the cow herd. And a good rule of thumb to work with is we need 1 cow per bull month of age up to 50 months. So a 48-month-old or 4-year-old bull should, in the ideal world, be able to cover somewhere between 40 and 50 cows with no additional help. Younger bulls, a 2-year-old, for example, we probably don't want to put him on any more than about 20 cows in his first breeding season. He's going to need a little bit of extra help to figure that out. As I said before, we talked about a breeding soundness exam. What we do know is, based on work that's come out of Colorado, is that for bulls that have passed a BSE, you will see a 6% increase in calf crop relative to bulls that have never had a BSE. This is not a bull that fails. This is not a bull that passes. They just don't have a BSE done. If I do a BSE, I'm going to get 6% more calves on average than if I don't do one. So what you see down below in this chart is a break-even analysis looking at the benefit of doing a BSE. And what we're looking at here is the cost of a BSE from $50 up to $70, and then the total cost per bull, factoring in labor and time for bringing bulls up. So the total cost is going to be somewhere between $60 and $80. And if you look at the total cost per exposed cow, between $240 and $320. And what we're going to see is our change in income with a 6% increase in calf crop is going to be the same regardless of what we're looking at. We're going to see an extra $57 per cow. What that comes out to be, depending on cost, is anywhere from an $18 up to a $24 per cow return on my investment. So for every dollar that I spend on a BSE, depending on where my cost is, I'm going to get an extra $18 to $24 back on that. So it's a pretty big bang for your buck, the impact of a BSE. So this is a place, if you're not doing them in your cow herd, this is something you definitely need to consider because the impacts are positive regardless of the way you look at it. Other things we look at, in addition to enhancing the percent calf crop, is how do we manage weaning weights. So this table here is looking at change in break-even price with 50-pound increments in weaning weight. And we're holding calf crop and cow cost steady at 85% and $500 respectively. What you're going to see is if weaning weight is 500 pounds, the pounds of calf I wean per exposed cow is 425. My break-even price is about $118 per cow. If I've moved my weaning weights from 500 pounds to 600, the pounds of calf weaned per exposed cow increases to 510, and my break-even price drops to $98. So just going up 100 pounds in weaning weight decreases my break-even price by about $20 per 100 pounds. So it's a fairly dramatic impact with that. Things that we can do to manage weaning weights, one is genetics. And that goes back to looking at milk production by the heifer or cow. It goes back to sire selection, picking sires that may be enhanced in genetic potential for weaning weights. But something we can use in almost every herd would be crossbreeding. Crossbreeding gives us improvements in reproduction and also improvements in growth and milk producing potential without having to have any EPDs or other numbers to work with. Crossbreeding is a very, very powerful management tool. Other things that are important, the age of the calf when they're weaned. An older calf is going to weigh more when it's weaned. And that goes back to the concept of reproductive efficiency. And what I want to do is more than focus on getting cows pregnant, is how quickly I get them pregnant during the course of a breeding season. If I've got a 63-day breeding season, I want to make sure that I'm getting as many cows pregnant in the first part of that season as I can. The idea behind that, again, is when those calves are weaned, they're just going to be older than the calves that are born later during the course of a calving season. As Dr. Hines mentioned, again, nutrition, and then things I'm going to focus on now, growth implants and DEWORMERS. So when we look at implants, what we know is that in nursing calves, implanted one time, you're going to see somewhere between a 5 and 6% increase in weaning weight. And that comes out to be a roughly 1/10 of a pound per day increase in average daily gain, which equates to somewhere between 20 to 30 additional pounds at weaning. If we're looking at stocker calves, you're going to see about a 10 to 20% increase in average daily gain. And then in cattle in a feed yard, it's somewhere between 15 and 20%. So with these implants, you're getting a fairly big bang for your buck with the impact you're seeing on performance. If we look at an economic evaluation of implanting nursing calves, we're going to look at the cost of an implant, in this case being $1.22, and the difference we're going to see in weaning weight between an implanted calf and an unimplanted calf is 20 pounds. So in this scenario, my 500-pound steer is going to be worth $937, and my 520-pound steer is going to be worth $964. And I realize these market prices are probably a little bit out of whack with where they currently are, but the concepts still apply. The return on my investment is almost 2,700%. And the profit per hour, if these calves are destined for a feed yard, is nearly $1,800 per hour. So looking at these implants, there's probably not a lot of other things that you can do legally to generate $1,800 per hour, but this is what these implants are giving you. So a very, very powerful tool from a management standpoint to increase weaning weights. If we look now at some USDA survey data, across cow-calf operations in the U.S., the vast majority of them are not using implants in any production class, just a little over 10%, in fact. So if you look at this, this is a place where, as cow-calf producers, we can do a lot more. incorporating these into our management schemes to get those benefits. A lot's being left on the table by not using these. And this is something that, again, across the US is not being used on a large scale. One of the things that I get questions about when it comes to implants is how safe are they? If I implant this steer, if I implant this heifer, particularly a heifer that's destined for a feed yard, am I going to see health issues because there are hormones now in that animal? So this is looking at estrogenic activity in different types of food. And what you're going to notice is when you compare implanted beef to non-implanted beef, there is no difference. If you compare implanted beef to milk or eggs, cabbage, or soybeans, the amount we're seeing in those products is so minuscule relative to other commonly consumed products that the health concerns really just aren't there. So these are safe, these are effective, and as I said before, underutilized. Another thing that I like to show, again from a safety standpoint, is 3 ounces of beef from an implanted cow. There are about 2 nanograms of estrogen produced per day. If you look at a pregnant woman, somewhere between 90 million nanograms of estrogen a day, and an adult male, it's in excess of 100,000. So again, when we're concerned about health, relative to what we're producing naturally across the course of a given day, implanted beef is going to be relatively safe. And it's something that, again, we need to adopt a little bit more often. Moving to dewormers, Dr. Hines touched on a lot of the issues we have with dewormers and set out some control programs that can be used. But looking at the economics of this, and something I hope that can convince you to change some of the protocols you might be using, is we know that calves that are weaned to cows that are dewormed prior to calving will weigh 26 pounds more on average than calves that are born to cows that are not dewormed. Replacement heifers that are dewormed appropriately, you'll see about 15% increase in pregnancy rate. And in those same heifers, you'll see 10% increase in weaning weights of those calves. So a lot of productions coming along with this that make dewormers important from more than a health standpoint. So if we look at the big deal, again, we're going to assume that we're going to get anywhere from a quarter up to nearly half a pound per day increase in average daily gain in a growing calf. Over a 60-day growing period, that's going to be somewhere between 15 and 30 pounds. And again, these prices are a little bit old, but the principles still apply. At those weights and at this price, you're going to see an extra $25 to $50 per head, roughly. With 100 head, that's $3,000 to $5,000 in gross revenue. If I just used a white paste dewormer, so Safeguard, Synanthic, Valbasin, it would have cost me about $150, roughly $1.50 per calf. At those numbers, looking at those weights, it's similar to an implant, 1,500 to 3,000%. So again, this is a place that's a wise investment. You can't get these types of returns in the stock market year in, year out. And if you combine this, deworming strategies with implant strategies, the returns can actually be synergistic with one another and greater than what we're seeing here. So as Dr. Hine mentions, resistance to dewormers here in the Southeast is a real thing. This is some work that was done by the parasitology group here at UGA. And what they found was that a group of calves on several cow-calf operations here in the state, after they were given ivermectin, their fecal egg counts actually went up. So rather than going down, they actually went up. And that gives you some sense of the scope of the issue we're seeing with is that when they're dewormed, fecal egg counts are going up rather than going down. Some other work by that same group looking at Poron Epernex. What they found was when they gave Poron Epernex, egg counts only went down by about 26%. Keep in mind, we're looking at somewhere between 90 and 95% to say that they truly work and resistant isn't present. So in this situation, 26% just doesn't cut it. When they look then at a combination of Poron Epernex and Safeguard orally, they had a nearly 98% reduction. So big difference in efficacy when we combine those two dewormers. We go from 26% all the way up to 98%. When we look at what's being used across the United States and how well they worked, if we look at brand name Porons, so your Poron Cydectin, your Poron Ivermectin, those types of products, what you're going to notice in half the herds they surveyed, less than 90% fecal egg count reduction was obtained. So with these pour-on dewormers in a lot of cow-calf herds, less than half are going to achieve our actual target. When we look at generic pour-ons, 75% don't reach the desired target. So this is a place where I would encourage you, as Dr. Hines said with vaccines, if we're choosing dewormers in our cow herd, whether it's pour-on or injectable, make sure we get a good name brand product. They're going to cost a little bit more. That's okay. The returns we're getting are going to offset that increase in cost because they are more effective. Again, 75% are outside of our range versus only 50 here. Another thing that you'll notice, we have brand name injectables. So rather than pour-ons, we're going to a shot at this point. And here we move from 50% down to under 20. So again, another place where we want to say maybe the pour-on aren't our best option. Just something to think about. And if we look at our oral pastes, none of the herds were less than 90% of their oral paste, although again, they only had 5 herds there. So this is some data that we've collected across several experiment stations here in the Southeast. And what we did in this study is we looked at weaned calves, and we had them in one of 4 different groups: no dewormer, pour-on dewormer only, white paste dewormer only, or combination. What you're going to see is, regardless of strategy, deworming increases average daily gain relative to doing nothing at all. But when we looked at using a paste or both, what you'll notice is we saw an additional 0.2 to almost a 1/4 pound per day increase in average daily gain. So again, it's a powerful, powerful thing there. Using that white paste dewormer in our herd health protocols, you're going to see that benefit in average daily gain. What you'll see is weight gain over the course of that study is anywhere from 58 to 59 pounds, which is a 10 pound per calf advantage. And what we saw, using only $1.20 per pound as our market price, is our drench and both were better than just the pour-on, and certainly better than the control by itself. So even with cost of the dewormer included at the low market prices, that combination dewormer in these weaned calves not only again is more effective, but we're seeing improved performance and more money in your pocketbook. This is some work that came out of Iowa State probably 10 years ago. So the numbers that you see here are going to be a little bit different. And what they're looking at here is what is happening to my break-even price and cost of production if I took different technologies out of my cow herd. If I took growth promoting plants out of cow-calf production totally, my break-even price would increase by 6%, and the cost per head would increase by $28. In other words, based on this analysis, if I'm not using implants, I need to see an additional $28 per head in market value to make up for not using it. When I look at dewormers, if I don't use dewormers in the cow herd, or if I use a dewormer that's ineffective, my break-even price increases by 34%, and it costs me an additional $165 per head. So again, these two technologies by themselves are worth $200 per head and a reduction in break-even price of nearly 40% just by using them and using them appropriately. So again, when we look at just increasing income, those are important, but also decreasing cost, it becomes important too. So just some things to think about where not only does this protect animal health, but it also helps you on the back end too. Other things we can do looking at improved calf management, uniformity in lot size. Some studies that have come from the Southeast and other areas of the US have found, depending on what barn you go to, a $3 per hundredweight increase in price if I can get more than 5 calves in a lot. So that goes back to uniformity, controlled calving seasons. If I can get those things in line, I'm going to make more money just because I've got a product that more people want. Castration. If you look at the markets here in Athens, week in, week out, steers tend to bring on average about $10 per hundredweight more than bull calves do. Polled calves, not as much of an issue in beef cattle as it is in dairy cattle, but calves with horns are worth inherently less, on average about $5 per 100 pounds less. And then season. Calves that are marketed in spring are going to bring more money than calves that are marketed in the fall, just by the virtues of supply and demand, with less calves being in the market in spring relative to the fall. So that's what I've got. Again, happy to take any questions that anybody might have, and thank everybody for being here and part of this.
Thank you so much, Dr. Credile. Just a couple of questions here. You mentioned castration will bring 10 cents per pound higher on the calves. Is there a specific method and age that you suggest to help mitigate stress, not affect their growth, and still provide that return on investment?
Yeah. So the question goes back to castration, timing, and strategies to reduce impact on growth. And the most humane time to castrate a calf is going to be at birth. If that's when we can get it done, that's when we should get it done from the standpoint of animal welfare. That being said, there's I think a little bit of misinformation out there related to the impact of those testicles on growth between birth and weaning. And I didn't show it here tonight, but there is some data that was done by Dr. Jim Strickland years ago out of Tifton, where they compared calves that were castrated at birth to calves that were castrated later. And what they found is that castration at birth had no impact on average daily gain at all. Those calves don't hit puberty until they're somewhere between 8 and 10 months. So if we're castrating them at 1 day of age versus later on in life, 1 day of age is going to be better from a welfare standpoint, and we're not sacrificing production at all. Going back to method, you know, it really doesn't matter. I would tell people whatever method you're comfortable with, whether it be surgical castration, a band. I think the most important thing we do is we get it done because of the opportunities that exist for us. So,
thank you for that. I had a question come through the chat box. What BSE test score would you recommend for a bull?
So the question is BSE test score. So for us, when we perform a BSE, there are 3 categories that we will put these bulls into. One is going to be a satisfactory potential breeder. Number 2 is going to be a classification deferred. And number 3 is going to be an unsatisfactory potential breeder. The only bull that is suitable for a cow-calf herd is going to be a bull that is classified as a satisfactory potential breeder. That's it. A bull that is classification deferred, we can retest at a later date, depending on what abnormalities we're finding. If he's an unsatisfactory potential breeder, he needs to probably seek life with another employer. My vote would be McDonald's in that situation.
Thank you for that. You just mentioned retesting a bull later. Did bulls just ever have bad days? If they're testing one and they're close to passing, is it worth rechecking them? And how much time should you?
Yeah, so certainly, if a bull is having a bad day, the weather that we've had lately can put a lot of stress on sperm production. As hot as it is, it can put a lot of stress on sperm production. And if they are sick, fever can also impact sperm production. We know that young bulls, for example, are more likely to have problems on their first BSE than a more mature bull. So based on what we see on that breeding soundness exam, we can decide whether or not this is something that he could potentially overcome with just time, or if it's something that he's not able to overcome. I would say that for me, it's rare that I ever fail a bull with a single exam. A lot of the bulls that I see end up being classification deferred. And when I recheck them later, we often will pass them because they've overcome whatever issue it is. Your question about how much time, it depends. Normally we like to say 30 to 60 days. So a BSE is not something we necessarily want to do the day before you need that bull. If we do fail him or we do defer him, we need some time to make sure, 1, if we fail him, you can get another bull, but 2, if we defer him, he's got time to overcome whatever problem that is so we can retest him and make sure he's good to go.
Awesome. Thank you so much, Dr. Credile. Again, we really appreciate the information that you guys are bringing us tonight. At this time, let's just shift gears a little bit over to Dr. Jane Marie Hennebel with the Georgia Department of Agriculture. She's the Assistant State Veterinarian, and tonight she's going to give us an update on animal disease traceability. So Dr. Hennebel, if you would, please take it away.
Sure. Thank you, Dale. So now you've got some tips on having a healthy, productive herd. And so inevitably, either directly or indirectly, then you're going to want to be moving these animals across state lines. And that's where this whole concept and federal rule related to animal disease traceability comes into play. So just a little bit of background. Again, animal disease traceability, I'll refer to it as ADT throughout the course of this presentation, but really the goal is just we want to be able to know where diseased or exposed animals are and where they've been quickly. This is not going to prevent diseases from happening, but it can help us as animal health officials to reduce the number of premises and animals that are involved if we need to trace something. And that gives us an opportunity to reduce our response time, thereby better protecting animal health, the cattle industry, human health, and the food supply. So just a little reminder, next slide there, please. ADT is related to interstate movement. So the federal rule went into effect in January of 2013. I'm kind of just looking at a very high level 10,000 foot view here as a reminder that the ADT rule applies to livestock that are moving interstate. It involves official identification for certain animals and some type of a movement document, typically a certificate of veterinary inspection, also known as a health certificate. So there are certainly exemptions to the rule, and we're not going to get down in the weeds on that tonight. We're just going to kind of focus again, as I said, on this basic summary of the ADT rule. So what classes of cattle right now are required to be officially ID'd when they're moving across state lines? For beef cattle and bison, it's your breeding eligible animals that are 18 months of age and older. It's all of our dairy cattle. And then any of these cattle or bison that are being used in livestock exhibitions, shows, for rodeo, they all have to be officially identified if they're moving across state lines. So why do we keep kind of drilling down on official identification as opposed to some other format y'all may have seen over the years, 900 series tags, to use farm tags, all these different types of tags that are out there? The purpose of official identification is that it gives us a standard format for ear tags and a central location where they can be quickly searched if needed to try to figure out where that tag may have been or may be currently. And all of this comes back around to, again, disease prevention, management, and control. Really, our main goal is that we can quickly identify an animal to facilitate disease investigations. There are certainly other benefits. Obviously, from a trade standpoint, if we're moving any kind of animal products or live animals, it's a prerequisite for our trade partners that we have a standard official identification and some form of traceability to be able to do that. And from a management standpoint, it's really helpful if you have a way to track your own animals with a unique identification. That there's certainly a whole lot more that we could get into, but there are other folks who can certainly speak to some of those benefits better than I. So focusing again on what is an official identification device right now in cattle, I think we're all familiar with those silver or orange metal clip tags. Standard 9 characters. They've been in use for many years. And then more recently, you've probably seen some of these 15-digit electronic ear tags that we also refer to as 840 tags because they always start with that 840 number. That's our United States country code. So we know if an animal has that tag in its ear, it originated here in the US. Official identification ear tags are, other than having that standard format for characters, they're also imprinted with the shield. You'll see that US shield on an official ID device, and they're designed to be tamper-proof to the best of their ability. Next slide, please. So y'all may remember a little over a year ago, April 2019, USDA published a timeline, and the goal was we would move away from these visual only metal ear tags to an electronic ear tag for official ID purposes. There were some challenges to that timeline. So USDA pulled pulled it back and they've made some very minor changes, and then they've republished this proposed rule. They just published it July 6th, and it is open right now for public comments until October the 5th. So that proposed rule is the use of radio frequency identification tags as official identification in cattle and bison. And you can see a link here on that slide. If you want to read the rule in its entirety, if you want to post any kind of comments, you're welcome to do so through October 5th. So let's hit on some 3 key points really that are coming out of this proposed rule. 1, January 1st, 2022, USDA is not going to approve any vendors to continue using that US shield on metal ear tags, okay? Metal ear tags or any other tags that don't have a radio frequency identification component. So if they're not electronic, able to be read electronically, then they won't be an official ear tag. Our second point, starting in January 1 of 2023, those radio frequency identification ear tags are the only official identification devices for cattle and bison, eligible cattle and bison. And then finally, this is a little bit of a change from the initial timeline, but if we have any cattle or bison that get metal ear tags put in prior to that January 1st of 2023, those ear tags are going to be recognized as official ID for the lifetime of that animal. So you're not going to have to change anything out. They can rock and roll with a metal ear tag as long as it's applied before January 1 of 2023. All right, so let me just recap again. So we're looking at January 1, 2022. Metal ear tags are no longer going to be approved as official ID. January 1 of 2023, we've got electronic ID, also known as a radio frequency identification ear tag, as official ear tags for cattle and bison. And let me just hit it home again. It's only those eligible cattle and bison that have had to be tagged since 2013. So that's not changing. And on my next slide, I just am reiterating that point. These are the classes of animals that will get an electronic ID tag if they need to be tagged starting in 2023. So electronic ID, you know, you've probably, if you've been in this industry, you've been hearing about it for a few years, but why do we keep harping on that compared to a visual ID tag, a visual official ID tag? You know, if you can read something with a little more distance, that's going to increase your speed at reading ID. It increases your accuracy if you're not having to transpose numbers onto a paper or some other format, trying to read a visual only tag. And both of those factors, increasing the speed at which we can read an ear tag, as well as the accuracy with which we can read an ear tag, it improves our reliability when it comes to tracing tags for disease purposes. Additionally, these RFID ear tags are intended to have a high retention rate. So especially the buttons, if you've seen them, if they're properly placed in the ear, you can have a really satisfactory retention rate on that tag. So just a little example, let's just compare what I like to call, this is my metal ear tag reader, right? The chute with the head catch, hopefully. A person that's trying to wrangle ahead, a metal ear tag that may or may not be legible once you clean it off. If you're lucky enough, you're shouting out a number to somebody who's writing it down for you. If you're unlucky, you're trying to read it and write it down yourself. And then the cow coming up behind her in the chute, she's lame. Why is she lame? Because we just found part of a metal ear tag in her foot. You know, we've got earfold dermatitis going on where the tag should be. So this is kind of our approach, and has been for many years, with trying to read metal ear tags. Now let's just compare that. For our purposes, I'm focusing on reading low frequency electronic ID tags. You've got a couple of different options. You've got many different sizes and styles of portable handheld readers. They've got different bells and whistles depending on what you need them to do. And then there are these panel readers. Smaller panel readers work great if you need something mobile, if you need something you can kind of take with you. And then there are larger panel readers that are designed to be fixed in place. So you can see in this picture here, we've got, you know, cows just walking down the alleyway, walking by the panel reader. No head catch, no crazy gymnastics to try to get an ear tag read. Yes, they work best if you can get cattle moving single file. But often if you have a cow that comes one right after the other, they'll read that ear tag just fine. The readers, as I mentioned, have different bells and whistles depending on what you need them to do. They can have Bluetooth capability to download any ear tags that you've read to your mobile devices, your tablet, your laptop. They could have a USB port, so you could capture that information on some kind of a USB device and then upload it to your laptop or whatever you might like. The handheld readers have a nice long battery life. We see about 8 hours of battery life, so you should be able to get a lot of work done before you run out of battery. You don't need internet to read the tag. The reading takes place between the reader and the tag itself. And readers that are currently on the market are designed to read all electronic ID that meets standards. So you don't have to have a specific manufacturer's reader to go with their specific tag. So let's talk about, again, low frequency tags. Here in the Southeast, we have more infrastructure for low frequency tags. We see a lot more low frequency tags than other options like an ultra high frequency tag. And regional cattlemen's associations have supported that this is really the technology of choice for the Southeast. So we see two different types of low frequency tags, and really the main difference between them is kind of how that signal works between the tag and the reader, and there's a little bit of a difference between the read range. So a half duplex tag is a newer technology compared to a full duplex tag, and it gives you a little bit greater read range of approximately 16 inches if you're kind of in best case condition. So again, that's the distance you have to be from the tag to get a good read. So what I wanted to do is try to kind of give you a snapshot. What really is the positive benefit of an electronic tag versus having, again, to read a visual tag? So I'm going to show you an example of cattle movement. I just went back over the past 2 years. I pulled a little snapshot of an October to December time frame where we had over 200 shipments of cattle coming into the state of Georgia. They came from 24 different states, and that was a little over 1,200 head of cattle that we had coming in during that time period. So our livestock are moving, right? Probably much more than they ever have before, train, plane, and automobile, just to name a few. So in this schematic, you can see these are the 24 different states that we received cattle from during that 3-month window. And just take note that several of those states have an international border with either Canada or Mexico. And then what I did is I just looked at some disease data from the last couple of years to kind of overlap and show you how animals and their diseases can also move into our state. So let's just start that kind of green circle there up around Montana, Idaho, Wyoming. That's roughly the greater Yellowstone area. They have a robust program in place for surveillance of Brucella abortus or cattle brucellosis because they have ongoing issues with transmission from elk to their domestic cattle and bison in that area. Well, lo and behold, of course, in this example, we certainly received some cattle from Montana during that October to December window. The second thing I want to highlight there, the TB, there's 5 states that have TB on it. And during calendar year 2019, these 5 states had new TB infected herds that they identified. These were both dairy and beef herds. Now you may recall that all 50 states and territories are free of bovine TB at this time, but unfortunately over the last few years, we've seen it kind of rear its ugly little head again. And we have seen events like this where states are identifying newly infected herds. And again, look at that. 3 states that had bovine TB are also states that we received cattle from during just a 3-month window. And then finally, the VS refers to vesicular stomatitis virus. We have a current outbreak going on here in 2020. It's affected 8 states so far. Now, vesicular stomatitis virus, we primarily think of it as an issue more for horses than cattle, but it can infect cattle. And when it does, it causes these vesicular or ulcerative type lesions, the mouth, the tongue, etc. It's clinically indistinguishable from foot and mouth disease. So we respond to these reports very quickly because, vesicular stomatitis virus is certainly what you want to hear. You don't want to hear that it's foot and mouth disease. But again, take note, during the current outbreak, there have been cattle affected. And of the 8 states that have been involved year to date, we had received cattle from most of them during this kind of snapshot that I was showing you guys. So all of that comes back home to what I kind of started off with. What is the point of having an efficient, quick, accurate, reliable way to trace ear tags that are attached to animals? It's for disease investigations. The sooner we can find exposed or infected animals, the more likely we are to be able to limit it to just those premises, just those animals, and let the rest of the industry continue on with business. And a couple of other comments too to that effect is, as Dr. Hines was saying earlier, biosecurity, things like biosecurity, things like supporting a robust ADT program with electronic ID, those are steps that they might prepare you if you ever do encounter a foreign animal disease like foot and mouth disease. Let's hope we don't in our lifetime. But more practically, these things will actually help you manage and respond to our day-to-day domestic diseases as well. So if you are interested in ordering some electronic ID tags, hopefully, and we're going to start making believers out of everybody, you will need a national premises identification number. A lot of y'all probably already have that. It's just a 7-digit code that associates livestock with a specific premise. There's no cost, that's all you need, and then you can start ordering electronic ID tags from some of these manufacturers that are listed on the bottom of the slide. Additionally, next slide. Additionally, you might have seen the 12th of August, USDA announced that they had contracted with several manufacturers to provide some free low frequency RFID tags. And they're doing that by passing them on to us at the Department of Ag. Right now, we've received just a small supply. We're hoping to get more. We're eligible for more, but right now we have a very small supply in hand, and our intention is to distribute those equitably to our food animal veterinarians, to our livestock producers like y'all, markets, exhibitors, etc. The goal is, again, that we have some time before we get to 2023 to get some more of these tags out. So if you need premise ID, if you need RFID ear tags, you can contact our animal health program and we can help set you up with that. And then just one final comment, if you are applying official ID tags yourself, there's a couple little components of record keeping that are really helpful to make traceability work. So if you're putting an official ID tag, like one of these free 840 tags, into one of your animals on farm, simple things we need to know: date, what's that tag number, a few details about the animal, and then say, you know, you're shipping a load to somebody across state lines in Alabama, where did they go? And then you just keep that record for 5 years. It would be available in the event that we ever actually did need to do some kind of a trace. Capturing this data is even easier with electronic ID as well. As I said, with some of the bells and whistles and the apps of a reader, you can actually capture some additional details right there with the reader itself, or you can key it in really easily once you've got it on a tablet or a laptop or something like that. And so with that, that's just a brief overview and an update on ADT, and we'd be happy for you to reach out either at the phone number or the email if you need either a PIN or would like to take advantage of some of those tags.
Got a couple of questions that we're working through here. One specifically, what if I sell my cattle to someone, I've gone through and I've added the ADT tag to them, or the EID tag to that animal. What happens then? When the next buyer comes along, do they cut out that tag, retire it, and go, and install their own because it's tied to my PIN number?
Sure. Yeah, that's a really good question. So no, an official ID tag is not to be removed. That is a federal law that once it's applied, it should stay in place. So if you're selling cattle, what's going to happen when it moves on to somebody else is that ultimately, you know, all of our animals reach a terminal point, and if it's at a slaughter plant, then we can capture that ear tag information and retire the tag there. If the producer keeps the animal, maintains it on farm for whatever purposes, then at that point, that ear tag would be cited if they did something along the lines of selling it through a livestock market. Again, if it went to something like a processing plant, we capture just individual sightings of that ear tag and that animal where it's located. Again, for your purposes, from a record keeping standpoint, you have a clear record that you've sold that animal, that it's moved on, it's no longer associated with your premise as well.
Okay. Another question. Privacy tends to be a hallmark of our industry. We don't like to share much more than the rain, the weather patterns in our area, and the number of what our cows brought at the sale barn, if especially if it was bad. What's the focus as far as the privacy and the data that's being collected? Who's got who maintains that data, and how is that controlled?
Sure. So the data points that we're really interested in, honestly, are not tied to you as a producer or your personal information. We're interested in the ear tag, where it was cited, and some pretty basic information about what animal is tied to that specific ear tag. From a privacy standpoint, data is generally held. There are some other industry partners that are looking into privately held databases where things like ear tag information would be released to animal health officials if it's necessary. But at the moment, these official ID tags are in a central repository, a federal repository that is only used and accessible if you're doing a disease investigation. And for example, I cannot access everyone's ear tag information from states that I'm not an animal health official in. So I can only access ear tags for Georgia animals and see where they have been applied here in Georgia and things like that. So we take privacy very seriously, and we need to focus again that, at least from my standpoint, the goal is that we can efficiently trace animals for disease purposes. We're less interested in, frankly, human private details.
Okay, one last question on, you mentioned you put that tag in there, the information goes to the central database. At what other areas or points is that information being collected post once it's been?
So again, it's really at animal collection points is where it's being captured. So again, that's going to be any kind of interstate point of sale, a buying station, a market, things like that, or at a terminal location like a processing plant.
Okay, so not individual sightings through veterinary touch points? That's a really good point to bring up as well. There are other avenues where we could have a sighting. For example, if an animal is TB tested, if an animal is vaccinated for brucellosis, that sort of thing. So thank you for bringing that up as well, Dale. I will say though, the primary sightings we see are actually through these commingled points of sale and these commingled terminal points. As you all know, there's not necessarily the same emphasis on things like TB testing or brucella vaccination that there used to be. So we don't necessarily get as much data from those sources as we do from anywhere where you have large populations commingling for sale or slaughter. Absolutely. Mm-hmm. Well, thank you so much for that insight on the changes and update as to what the new timeline is. GCA will be submitting our comments in support of the EID shift, but also we'll be encouraging our members to submit their own comments. But again, thank you for your time tonight, Dr. Hannibal. In addition to that, we have Mr. Jason Wamba, who's also with the Georgia Department of Agriculture. He is the Assistant Director of Warehouse and Bonding. Jason has got a very long slideshow prepared for us tonight, so everybody hold on to your hats. But again, Mr. Wamba, we'll let you take it away at this time. Give us just a second. Let's get you unmuted.
How about that?
We got you now.
All right. Thank you, Dale. And thank you, everybody that spoke before me. And actually, Dr. Hines and Dr. Credile kind of led into my part of this. You can put all the money into these cows that your livestock that you want, but unless you know who you're selling to, if you don't get paid for that animal, you're not getting out of it what you're wanting to, because you're not going to end up getting paid for it. I urge everybody to ask a simple question: are you licensed and registered and bonded with Packers and Stockyards? And a lot of people don't think that's a big deal, but when it comes down to somebody coming out and buying an entire herd and they take off and you don't get any of the money, all the money that you put into taking care of everything doesn't matter if the end return isn't there. You can go ahead and go to the next one. Go to the next one. Oh, there it is. I saw it. My bad. And I've actually already covered that, so you can go ahead. If you don't get paid, and a lot of people wait, and I've had one wait 180, 190 days, and at that point, there's really nothing that Packers and Stockyards or anybody can do. You only have 60 days from the point of transaction to get your claim in. I tell everybody that as soon as you have that, I wonder if I'm going to get paid, it's best to reach out to us, either me at the Georgia Department of Agriculture or through Packers and Stockyards ourselves. Call us and ask us. Say, hey, can you reach out to this guy? And I personally can't tell you how many times I have been on farms, drive around until I find someone and go, hey, what's going on? Why haven't you paid this guy? And 90% of the time, it's going to get rectified right then. But you have 60 days to file your initial claim to start the process. If you don't do that, there's nothing we can do. Go ahead and go to the next one. The easiest thing for you to do is to save everything. And it doesn't matter if it is a scrap of paper. I've had people give me information on napkins. It doesn't matter. As long as you have it, no matter how small it is, voicemails, emails, text messages, phone logs from where you've tried to reach them or anything like that, the smallest amount of information can give us the biggest help. If they're doing promises or it shows us that they're trying to defer payment. They're trying to defer payment. That gives us more of a leg to stand on, and I can send that to the USDA to say, here, this is what I found in my investigation, and they will take it from there. We actually don't, we only hold the bonds. We don't actually do the bond recovery. I'm part of the step, but they're the main step. They would send an actual investigator out to go after them and do the full investigation. With that, if anybody has any questions, please feel free to reach out to me at that number or that email. Packers and Stockyards can be reached at the number at the top of the screen. I'm always available. That number is always ringing, and I'm always answering. So never hesitate to call and ask your question. If you've got somebody that you're dealing with and you just want to know if they're registered and bonded, that information can be found at the USDA website for Packers and Stockyards, or you can call my office, and we keep an up-to-date list that we print weekly that gives us every bonded buyer in the United States. And all I have to do is look and give you all that information. I just can't stress enough, don't wait too long, and don't be afraid to call us. That's what we're here for. We're not out there trying to get people and put them out of business. We're just trying to protect all the Georgia producers. With that, Dale, I'm going to turn it back over to you.
Jason, thank you so much for that. I know it's important, especially when you're selling off a large number of cattle or hopefully having a big payday that you expect to see that check in the mail. And when it doesn't come, it's pretty disappointing. Jason, is it illegal to buy or sell cattle without being bonded?
No, it's not actually. As long as it's person to person and you're not doing it on commission, you can do it all day, as long as you're buying for yourself.
Okay. What does it typically cost to become bonded? What's that process look like?
The process, going off of the other bonds that I deal with through the other parts of warehouse and bonding, it's normally 1 to 3% of the premium is 1 to 3% of the coverage. And it varies with packers and stockyards. They have different formulas that they use to decide how much you need to be bonded for. And we have bonds for as little as $10,000. And if you're talking about 1 to 3% of $10,000, that's not a whole lot just to be able to operate legally.
Well, thank you again for that. Again, folks, if you have any questions, feel free to enter them into the chat box. I know it's not a topic that is normally covered through any of these education series, but when it happens to you, you really want to make sure that you're dealing with somebody that is bonded, because as Jason said, once that clock starts, there's no turning it back. You can't come back at 61 days and expect to get your money at all. So again, thank you for your time tonight. We certainly appreciate that insight you provided. At this time, we're going to shift gears a little bit over to Dr. Jill Lancaster, who is with GVMA, the Georgia Veterinary Medical Association. She is currently serving as their president. She has a private practice here. What would you say, Bibb or Monroe counties?
Well, Bibb, Monroe, plus about 10 or 12 others. So we have a wide range. But just wanted to let all the producers on this call know that, the Georgia Veterinary Medical Association is a statewide organization. We've got member veterinarians all over, so you ought to be able to find one in your area. We all work in private practice, whether it's large or small animal. We've got some folks in the government and the regulatory part of it. We've got some that work at the feed and drug companies. Of course, you've met a couple tonight that work in academia at the vet school. We got people working in research. We've got veterinarians pretty much with their hands in all parts of this industry. So we work with sale barns, feedlots, work with FFA and the 4-H. We try to do a lot of work with the kids. So I'm sure a good number of you have some children working in those programs, showing hogs and heifers and steers and such. We have close communication with the Extension Service too. And we do all sorts of livestock, poultry, backyard farms, big farms, little farms. So we try to do it all. So if you're needing to find somebody, I know sometimes it's hard to find a large animal veterinarian in your area. You can get on the Georgia Veterinary Medical Association website. We do have a section on there for the public where you can go to it, look under resources. We'll have the website listed here in a minute, but go under resources and we've got an online directory where you can, quote, find a vet. You can check for your general area, look up your zip code or your county and see who's close to you. And of course, you can always call the office and talk to us if you need to. So we do have very good relationships with all of the agriculture industries in the state. We work closely, obviously, with GCA. We're in the Georgia Agribusiness Council. We've got, we work with Farm Bureau, the poultry folks, of course, very close communication with the Department of Agriculture and the College of Veterinary Medicine. So we try to keep good relationships and good communication with everybody we can that's involved in our industry. So as GVMA veterinarians, we can help you with your herd health, your production management. As everybody's said tonight, we really need to look at how to optimize your reproduction, your breeding, and see if we can straighten out your nutrition. There's a lot of things that we could help you with. What we try to do is look at the big picture and help you out long term, but the key to it is calling us and getting what I call boots on the farm, because we can't help if you're just calling every 2 or 3 years when you've got a cow down and having a dystocia, you've got a calf diarrhea problem. We'll of course help you with that, but we'd like to get on the farm and see your whole picture and help you with your management. We can help you with all the vaccine protocols that the veterinarians tonight have spoken with you about. And sometimes, call us and we can help you make those hard decisions when you've got to cut down the herd and try to, reestablish you got some problems going on. We can sit back and take a look at it and maybe see things that you don't see. But the moral of the story is don't wait until you've got a crisis to have a relationship with your veterinarian. Get us there, get us to help you get started from the beginning and see what we can do to help you out, because it's all about maintaining production and keeping your cash flow going, as everybody tonight has talked to you about. So please look us up, give us a call, let us help you in any way we can. We've got the communication here. Just let us know what we need to do for you. I would like to say we are putting on a food animal conference at Callaway Gardens, September 18th through the 20th. It's open to producers in addition to veterinarians. You'll see some of these topics that we talked about tonight addressed, and you'll just get to meet some folks and see what we can help you do. So please let us know if there's anything we can do for you.
Dr. Lancaster, thank you so much for that. I know that GVMA is very active. I know we work very closely with y'all, both on the legislative front and then also with herd health issues and specific concerns there. One of the biggest questions that we get here in the office is, there's no large animal vet in my area. Is there a way that GVMA, I know you said you've got the Find a Vet program. Is that the best way for a producer to secure veterinary services in their area?
Yeah, like I said, you can get on the website and put in your area. There's, of course, not going to be a veterinarian in every county. Most of your large animal veterinarians are going to be pretty spread out, like I said when we started out. But you can call somebody that's close by, and if that person isn't able to get to you, most of us know each other, and so we can get you hooked up with somebody that is closer to you and can certainly help you out.
Awesome. I know your GVMA is also very active as far as encouraging new vet med students coming in. What do you see the potential for growth in that area in the next 5 years? You see that as pretty robust?
We're trying. We know there's a problem. We're working with a couple of different programs. The University of Georgia College of Veterinary Medicine has a program in conjunction with the College of Ag and Environmental Sciences called the Food Animal Incentive Program. That's where we're trying to hit students before they come into the vet school, get them to commit out of the ag school and say that they're gonna, they want to come into veterinary medicine, they want to do livestock medicine, and that gives them a set slot to get in the vet school. So we're trying to approach it on that end. And then also after graduation, there is a loan repayment program, and there's one on the state level and one on the federal side. As far as the state level goes, it goes for, I think, around up to $20,000. It's renewable once a year. I think right now there's 4 slots for it. So we're trying to help students out after school too, if they commit to practicing in a rural area, underserved area for livestock practice. So trying to hit it on both directions and see if we can get some more large animal veterinarians out there in the field.
Sure. Are there any other initiatives that GVMA is working on that you want to share?
Well, we're just, like I said, we're trying to keep communication up. I think, one of the things that we've been talking with this year is getting on with students at the high school level, getting these folks that are interested in this profession and on the rural side, catching the students as they're going through, like I said, the 4-H and the FFA. A good number of us are just trying to keep good communication with the high schools and seeing if we can start early and catching these kids that are more likely to get into the business on this side.
Absolutely. Well, thank you again for your time tonight, Dr. Lancaster. And we want to share a special thanks to the GVMA for allowing us to partner with you tonight on the webinar series. This having the additional abilities within this program has certainly made life a little easier for us over here at GCA, and we certainly appreciate the partnership that we have working together, as well as with our other panelists tonight. You know, we can't do it without you, and our producers know that. We rely on y'all for education and support on those technical needs when, you know, dad and granddad's past wisdom just isn't cutting it right for that topic. So again, thank you all for your time tonight. I do want to mention that Ms. Charleston Godowns is over here working the technology tonight for us, and she's done an amazing job at putting this together. So please share a bit of thanks to them. If there's any other questions, feel free to email us at GCA. We'll be more than happy to nail down an answer for you. And then also, again, as a quick reminder, as an attendee to tonight's program, you will be receiving a survey in your email. We ask that you please fill that out for us. It's pretty short. It's about 8 or 10 questions, just basically on the content and the structure of tonight's event. But this, again, helps us to be able to secure additional grant funding in the future, especially so that we can continue to bring educational opportunities to our producers. But again, thanks to all those from Georgia Department of Ag, UGA College of Vet Med, and the Georgia Veterinary Medical Association. We appreciate all of your contributions. For everyone else, thank you for joining us tonight. We appreciate your time as well, and we hope everyone stays safe out there. Have a good evening.